Hello, everyone, and welcome back to our second podcast in the Emergency Preparedness and Response series. My name is Srinath Yadlapalli. I'm a nephrology fellow at Indiana University School of Medicine, Indianapolis, and I will be your host. Today, we are joined by two distinguished guests. First, we have Dr. Jeffrey Silberzweig, who is the Chief Medical Officer of the Rogozin Institute in New York City and a professor of clinical medicine at Weill Cornell Medical College. Next, we have Sara Brady, who is the Chief Nursing Officer at Innovative Renal Care, where she is responsible for planning, organizing, and directing nursing operations and patient care services. Today, we will focus on preparedness recommendations and ASN's resources that have been developed to support these efforts. We will explore how ASN's response to specific emergencies has led to creation of proactive measures and valuable resources to help support when these situations occur. Sarah, let's start with you. What challenges do patients and dialysis facilities face during emergencies like hurricanes or earthquakes?
Yeah, thank you. I believe that we all have some tremendous emotional stress that probably happens during those disasters, but it's exponentially elevated for our dialysis patients and those that are caring for them. So during a disaster, patients in dialysis facilities face multiple challenges, including transportation, power outages, water shortages due to broken pipes and flooding. We have generator and fuel issues. Locating patients and their loved ones is also a big challenge. And then trying to coordinate the return of both patients and our staff after these mandatory evacuations occur.
Thank you, Sarah. Those are some significant logistical challenges for both patients and facilities. Given the severity of these challenges, Dr. Jeff, can you explain why emergency preparedness is important for nephrologists and their patients?
Emergency preparedness is crucial for nephrologists because kidney patients are particularly vulnerable during disasters, as you just heard. Nephrologists have to lead in the event of an emergency to be sure that patients receive the necessary care and that dialysis prescriptions are altered when needed. Studies have reported increased emergency department utilization, higher rates of hospitalization, and higher mortality among kidney patients after disasters. In addition to the multiple challenges faced by patients in dialysis facilities, closure of one facility may have a domino effect on neighboring dialysis units and hospitals, which are already strained during emergencies.
That truly underscores the profound vulnerability of kidney patients during emergencies and the absolutely vital leadership role nephrologists play. To delve deeper into that responsibility, Dr. Jeff, can you explain what is the role of medical director in emergency preparedness and response?
The federal conditions for coverage for dialysis facilities specify that the medical director is responsible for the quality and safety of patient care. In addition to quality, safety, policies, and procedures, the medical director is charged with leadership. Each facility is required to have a detailed plan for emergencies and natural disasters that are likely to occur in their geographic region. Medical directors are required to engage in and sign off on that planning. They have to ensure that continuity of care is provided. For example, patients need support in planning what to do if dialysis supplies like fluids cannot be delivered as contracted from a supplier. They also need help assessing the impact of power outage on a dialysis facility. They need to be able to assess how long the power may be out and how the facilities will ensure appropriate cooling and heating, as well as delivery of power to equipment like dialysis machines. They need to review the facility's plan as part of local and state emergency response organization and coordinate with these agencies. Ensuring that patient care occurs in a safe setting and that all systems, including water, power, and supplies, are checked and available and working normally. Working with interdisciplinary teams, they have to drill and practice the emergency response. And finally, they have to be able to determine that it's safe to use municipal water if RO water is not able to be provided, and that patients will be able to adjust to the water treatment system if the water treatment system is unavailable, and dialysis prescriptions may need to be modified depending on the quality of the municipal water.
Thank you, Dr. Jeff. That's a comprehensive overview of the responsibilities held by the medical director in ensuring preparedness and continuity of care. But of course, implementing these plans is a team effort. Sarah, can you discuss steps dialysis unit clinical and operational staff can take to prepare for disasters?
You're absolutely right. Preparation is key. It is essential for all of our staff to be prepared for both natural and unfortunately man-made disasters such as shootings or cyber attacks. Each of our team members need to be aware that they have a specific role and practice it regularly so they are prepared in case of an event. We should be conducting routine and regular drills with our teams. We should always have access to hard copies of protocols and our policies and dialysis prescriptions for our patients. We should have a really clear communication plan, ensuring that we know who to contact during an emergency. And always we should be really prepared by having some backup of the essential supplies and equipment that our patient and our teams need.
Thank you, Sarah. That's an incredibly important list of actions for staff to undertake. Given the extreme vulnerability of dialysis patients during a disaster, their personal readiness is equally paramount. Dr. Jeff, back to you. What emergency preparedness tips do you have for dialysis patients?
Patients with kidney disease should always begin by thinking about what emergencies they might face. They need to update their emergency contact information with the dialysis center and provide the staff with at least 2 alternative phone numbers, as well as the phone number for a backup person in case their phone is not available. Patients should carry their nephrologist's name and phone number, as well as the name and phone number of the dialysis center where they usually receive care. A great example of how to do this includes the Caser wallet card, which is intended specifically to provide that information. Patients should also carry a list of medications as well as their dialysis prescription, including information like their dry weight, and they should have a sufficient supply of medication available in case they can't obtain refills right away. Patients should also be aware of a 3-day emergency kidney diet in case they can't get to an open dialysis center right away. And patients can download a lot of this information from the ESRD Emergency Hub, which has a lot of useful resources. They can also listen to patient advocate experiences, which are available on the Caser YouTube channel.
Those are some crucial tips for dialysis patients. Now, considering their unique medical needs, what emergency preparedness tips do you have for transplant patients, Dr. Jeff?
So transplant patients are obviously in a slightly different category in that they don't need the information about a dialysis center, although it is helpful if they carry contact information about their transplant center. And they certainly should carry information about their transplant nephrologist, including name and phone number. As well, they should carry a list of transplant medications that they take. And it's critically important that they have a supply of medications to get them through at least a week, just in case they can't get refills.
Thank you, Dr. Jeff. Those are some excellent focus tips for transplant patients. Now, for listeners seeking broader resources on this critical topic, Sarah, where can they find more information and guidance provided by ASN?
Yeah, ASN has recently published an exceptional learning module called Emergency Preparedness for Dialysis Providers and People Living with Kidney Disease. It's an all-inclusive module that provides not only just general information, but specific information depending on different types of emergencies. For example, there's a section on hurricanes and tornadoes and many others. It can be accessed on the ASN Excellence in Patient Care site, and hopefully everyone continues to strive to find more information to be as prepared as possible.
The module sounds like an essential tool for preparedness. For those inspired to move beyond learning and take action, how can our listeners get involved in emergency response and contribute to resources?
You don't need to be a member of a committee to be active in emergency response and contribute to resources. We all see healthcare really stand up and rally when people are in need. But please feel free to engage with the ASN community, participate in training and drills in your local communities, and stay informed about the latest guidelines and best practices to not only to keep yourself protected, but those patients that we desperately need to care for in these times of need.
Thank you, Sarah. for those valuable insights on how our listeners can get involved. We have reached the conclusion of this vital two-part podcast series on emergency preparedness and response. My sincere thanks to Dr. Jeff and Sara Brady for sharing their expertise and walking us through the essential steps and resources developed by ASN to support our kidney community through crisis. And to our listeners, we hope you have gained important knowledge and resources from these discussions. For more information, remember to visit the ASN's website for emergency preparedness for dialysis providers and people living with kidney disease module. Thank you.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.